I'm Lindsay Hall, and you're watching the Plastic Surgery Channel.
Welcome back to Plastic Surgery News. Picture this. A little girl in Omaha is chasing a ball near the chain-link fence in her family's backyard. Suddenly, the neighbor's pit bull pushes the fence over and sinks its teeth into her arm. Although the neighbor is able to get the dog to let go, local authorities seize the dog and a judge ends up deciding its fate. Or this. A 5-year-old boy is playing on a grassy area in front of his home near Edinburgh, Scotland, when a neighbor dog attacks him. His face is so badly damaged that emergency facial surgery is required. Sadly, these are true stories taken from recent news, and incidents like these are far too common. According to the CDC, 4.5 million people in America were bitten by dogs last year, and more than half of those are needing medical attention were children. Children bitten by dogs often suffer heartbreaking injuries. Skin, muscle, and other tissues can be ripped away by a dog's powerful jaws, exposing crushed nerves and torn blood vessels. And the rate of infection from dog bites is about 15 times greater than that from a typical laceration. Fortunately, even horrible wounds such as these can often be repaired with plastic surgery. In fact, plastic surgeons performed more than 16,000 reconstructive surgeries after dog bites last year. In a typical procedure, a surgeon will clean the wound, reposition or replace missing or torn flesh, stitch severed nerves and torn facial muscles, and sew the edges of the wound back together under a microscope using sutures as thin as a human hair. Later, the remaining scars can be lessened by laser treatment, and the emotional scars can be managed with psychological counseling. Now, we're not trying to make you afraid of dogs. We all know that most pet dogs would sooner get hurt themselves than allow one of their family's children to come to harm. Nevertheless, most dog bites to children are from family pets or other familiar dogs. Fortunately, there are also largely preventable. Experts recommended training dogs from an early age, having them neutered, and making sure they get plenty of regular exercise. For more tips on preventing dog bites, visit the American Veterinary Medical Association online at www.avma.org. And on a completely different note, if you're at the age where you're starting to notice a few wrinkles and thinking it may be time to consider injectable fillers, you may soon have a new option. A new study demonstrates that a combination of adipose stem cells combined with micronized acellular dermal matrix, also known as alloderm, may be a better solution than collagen or fat transfer. Dr. Jin-Soo Lim of the Department of Plastic Surgery at the Catholic University of Korea, who is leading the team that is developing the new filler technology, claims this mix offers a softer, more natural appearance and may raise the bar in terms of aesthetic outcomes in dermal filler procedures. Dr. Lim recently told Cosmetic Surgery Times that micronized alloderm may be useful for the growth and differentiation of human adipose stem cells and provide a good scaffold for the stem cells when constructing fat tissues for fillers. This concept is still early in development, and more studies to evaluate its safety and efficacy are needed before doctors can determine whether it is a viable treatment option for patients. We'll keep you posted on future developments. It's time for a quick break, but we'll be right back with more plastic surgery news, including a peek behind the surgical curtain to find out what is keeping former Melrose Place and Spin City star Heather Locklear looking so youthful. We'll be right back.
Each year, more than 200,000 Americans undergo weight loss surgery. 200,000 people looking for a fresh start. The Weight Loss Surgery Channel is the world's first online television network devoted exclusively to the weight loss surgery community. Find the information, support, and guidance that can keep you on the road to success. You'll find it all online, 24 hours a day, at the Weight Loss Surgery Channel.